Infliximab is used to treat several different autoimmune diseases that are tied to excess inflammation. These diseases include rheumatoid arthritis, where inflammation affects our joints, Crohn's disease, which targets the digestive tract, ulcerative colitis, with inflammation flares throughout our colon, and plaque psoriasis, where inflammation affects our skin. More on these diseases later. First, to explain inflammation in autoimmune diseases, let's start with our immune system. Our immune system acts as our defense system and is a complex network of cells that work together to protect us against potential infections and diseases. When infections are introduced into our body, our immune system can cause inflammation to help eliminate the infection. Inflammation helps fight the disease by recruiting various fighters, such as white blood cells, and increasing blood flow to the infected area to help eliminate the infection. Let's dive deeper into this inflammation response. One of the major players in the inflammatory response is a molecule known as tumor necrosis factor alpha, or TNF-alpha for short. TNF-alpha is a cell signaling protein. Cell signaling proteins play a large role in our immune system and regulating immune cells. TNF-alpha is produced by white blood cells, primarily macrophages and T cells. When you have an infection or an injury, your white blood cells will release chemicals that signal other cells to cause inflammation. TNF-alpha is one of the strongest players in this inflammation process and plays a pivotal role in orchestrating the cell signaling cascade for inflammation, and thus is known as the master regulator of the inflammatory response. Our cells have TNF receptors that bind to TNF-alpha. When TNF-alpha binds to our cells, this initiates the pro-inflammatory signaling cascades. This inflammation response includes signaling to other white blood cells to attack intruders, and an increase of blood flow to the infected area. The inflammation of the infected area can cause swelling, an increase in temperature, and pain. And these are the negative symptoms that we associate with inflammation. Unregulated, inflammation can cause serious problems for our health. In healthy people, the body can turn off the inflammatory response and deactivate any excess TNF-alpha in the body to prevent excess inflammation. However, some individuals may not have the ability to turn off the inflammatory response, thus leading to excess TNF-alpha, which can thus lead to excess inflammation. As your body releases excess TNF-alpha and triggers excess inflammation when there are no intruders to fight off, this will then cause your immune system to attack your own body and tissues. These are referred to as autoimmune diseases. Let's dive deeper into specific autoimmune diseases where excess inflammation can cause serious health issues. Rheumatoid arthritis is when inflammation causes tissues inside of the joints to thicken. commonly affects the joints of the hands, feet, wrists, elbows, knees, and ankles, which then become stiff and swollen. In plaque psoriasis, instead of creating new cells to replace old ones, excess inflammation stimulates the body to create excess skin cells, even when they're not needed. The new skin cells rapidly push the old, dead skin cells to your skin surface, creating plaques and scales. Crohn's disease and ulcerative colitis both fall into a group known as irritable bowel disease, or IBD, where there is excess inflammation in the gut. Inflammation for Crohn's disease is targeted on the lining of the digestive tract, whereas ulcerative colitis results in inflammation flares in the colon.